Hi, welcome to Clyde Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Erica O'Neill, a licensed speech language pathologist at Clyde Health's Buffalo Therapy Services. In this episode, we'll be discussing Parkinson's disease and a new speech therapy treatment program called Speak Out. I'm Mike Hughes, and this is Medically Speaking. Welcome, Erica. Thanks for joining us today.
Thank you for having me.
We're going to ask you a little bit about the Speak Out program, but before we do that, if you can, back up, just to briefly explain Parkinson's disease and what that means and maybe how many people are impacted in it.
Absolutely. So Parkinson's disease is a progressive neurological disorder. It primarily affects movement, and it can affect people's walking, talking, voice, and swallowing, right? We have over 9,000 people in the Western New York area who are living with Parkinson's disease. And when we look at these individuals, up to 90% of them can develop difficulty with their speech. And 70% of the mortality rates may be due to swallowing difficulties resulting in aspiration pneumonia.
Right. So of the 9,000, is this primarily, from a demographic standpoint, 55 and older? Is there a specific age range or demographic that you guys see?
Sure. We do see more males affected with Parkinson's than females, and it does tend to get diagnosed a little bit later in life, usually in someone's 60s or 70s, but we do see earlier onset. As well, individuals maybe in their 50s, even on occasion, people in their 40s.
Right. So when people think of Parkinson's disease, often they'll probably think in the neurology field, a licensed speech pathologist like yourself, how you get into that and what your role is in something like Parkinson's.
Well, with Parkinson's, we focus on exercises to strengthen the muscles used for speaking and for swallowing. And that is how individuals see improvement in Parkinson's. So
you're involved with the Speak Out program, which apparently is a national program that's come here to Western New York. Tell us a little bit about that.
Absolutely. And it's not only national, it's also being implemented abroad, which is very exciting. And Speak Out was developed by the Parkinson Voice Project in Dallas, Texas. They're the only not-for-profit organization dedicated to preserving and restoring the voices of individuals with Parkinson's disease. We at Buffalo Therapy Services have been very fortunate in that we have received a grant this year that allows us to bring the program to the Western New York area. And we were provided with training and materials so we can bring this terrific program.
So you talked about 9,000 patients. How many of them would be involved in this type of program?
Right now, because the program is in its infancy, I don't have an exact number for how many patients we will be seeing, but we are prepared to accommodate a lot of them. But with Parkinson's disease, you never want to wait until the problem with speech becomes a big problem. So we always say earlier intervention is the best intervention. So again, that 90% number, it doesn't mean you have difficulty speaking now, but you may develop it as the disease progresses.
So is this something that the patient should know, the patient and the family member, the patient, the family member, the doctor?
Absolutely. Yes.
Is there anything that people with Parkinson's should be doing or can do to improve their speech or their swallowing?
Absolutely. Aside from speech therapy, which we can certainly talk about, daily practice is essential. Daily exercise is essential. This is a progressive disease, and although you can have improvements with therapy, if you don't continue to practice the exercises you're taught, you will start to slide back.
Is that so? As you go through your field and you're dealing with these patients, is it something that they end up taking for granted because they do have to stop and practice something that had been, just so second nature to them?
Absolutely. So the premises of Speak Out, the exercises that people learn to do really converts the act of speaking from an automatic function to a very intentional act.
Okay.
And it really is this automatic movement that is affected by Parkinson's. So by converting speaking to an intentional act, the result is a clearer and stronger voice.
Okay.
Okay, but daily practice is really essential
Gotcha.
to maintain that.
So that's a little bit about the program. Tell us a little bit more about the Loud Crowd and when do patients participate in that?
Absolutely. So when patients are done with the Speak Out program, which is the individual component of the therapy, they enroll in Loud Crowd, which is a group that meets once a week. And we are able to offer it free of charge to graduates of Speak Out. And in this group, it's facilitated by a speech therapist, and they practice their exercises. And then we also do a lot of fun activities to carry over the practice of speaking with intent.
Right.
And it also offers an opportunity for support and camaraderie, accountability.
So there's a social aspect to it as well.
Absolutely.
Gotcha. Do they need a referral to come in to Buffalo Therapy so they can call for more information, but will they need their primary care doc or their neurologist to refer them in?
Yes, they will. Insurances generally cover this program as it is skilled speech therapy.
Sure.
So we would have them get a prescription from their doctor, usually the neurologist,
Right.
and then we can set them up for evaluation.
That's great. Well, congratulations on the grant. Good to see you doing great work in the community with these patients. Thanks for joining us today.
Thank you for having me.
Thanks. I'm Mike Hughes. We'll see you next time on Medically Speaking.